Hi, good morning, everyone. My name is Dr. Monique May. I was asked to join by Dr. Kim Singletary, and as she mentioned, I am a board certified family physician, practiced for over 20 years in both primary care and urgent care, and also telemedicine. And so I have been asked to get on and help answer questions and just help her out because she is out there in the trenches every day, and we would greatly appreciate her and what she's doing. So, full disclaimer: any information that I'm saying, that Dr. Singletary is saying, this is not meant to diagnose, treat, or cure any disease. This is not meant to replace anything that your doctor has told you to do or not to do. So this is just general information, really just to answer questions that you can then go back to your doctor and make sure you're getting the right information for your medical conditions. So she asked me to talk about the role of vitamin D. I'm the founder of Physician in the Kitchen, and in that role, I help busy households enjoy healthy eating without impacting their hectic schedules through my videos, blogs, and best-selling Amazon book. So she asked me to get on and talk a little bit about vitamin D. So vitamin D is a very important vitamin that we need. It plays lots of different roles in our bodies, but one is in the immune system. And so we know that people who have low levels of vitamin D are at higher risk for having immunity problems or immunity challenges. And it also plays a role in lung health. And so people who have low vitamin D levels may also be at higher risk for having respiratory diseases such as COPD, asthma, or even tuberculosis, which is a lung infection, because low levels of vitamin D have been linked with that. Low levels have also been linked with just a decreased ability to fight lung as well, to heal from a lung infection. So, but right now, that is information we have in general. As of now, because COVID is so new, we do not have information specifically about vitamin D and COVID. So those studies have not been done yet. We don't have that information yet. Right now, there is no prevention other than the social distancing, staying indoors, if you're feeling sick, not being around others, covering your cough, or washing your hands, all of those basic things that you've been hearing about. Thank you, Alenda, for watching. I hope this is helpful. So vitamin D is not a cure, it's not a treatment, but we know that in general, it does have a beneficial effect on lung health and your immune system. But again, no studies have been shown to say whether or not vitamin D deficiency is linked to whether you're going to catch COVID or have a worse outcome if you do. So whether or not to take a supplement, vitamin D supplement, again, that is going to be specific for you based on your health history. If you've had a physical relatively recently, your doctor may have actually checked your vitamin D level. So you can either call your doctor's office, or preferably, if it's something like this, you can just check your electronic medical record. Oftentimes, a lot of your lab results are uploaded into your portal or your patient chart that you can access yourself, and you can look and see if there was a vitamin D level drawn. The range of normal varies. Some experts say anywhere from 30 to 50, 40 to 60. That's more for non-African Americans, Caucasians, and non-African Americans. For African Americans, the level is actually normal level is actually considered to be a little lower, such as 20 to 30. So a normal range for me is not going to be. That's why, again, we are speaking here in generalities, and you need to know what your specific numbers are in your specific situation. So that's a conversation you need to have with your doctor. If you're getting a well-rounded diet, you may not even need supplements. Well, number one, the main source of vitamin D is, of course, sunlight. So here in the South, I'm in the Charlotte area, not too far from Dr. Singletary. Like she said yesterday, we've been in the 80s here. So the sun is shining bright. Go outside. You can still go outside and exercise. Walk your dog, exercise. Of course, if you come upon someone, make sure you've got that 6 feet distance. Make sure you take the regular safety precautions, such as wearing a wide-brimmed hat, sunglasses, and sunscreen with an SPF of at least 30. So that's number one. Number two is your diet. You can get vitamin D in pretty much where you get dairy. So I'm sorry, where dairy products are a good source of that. Pretty much where you get your calcium, and calcium and vitamin D tend to go together. So dairy products, milk, cheese, eggs, fatty fishes like salmon, mackerel, tuna are all going to be good sources of that. Yogurt as is a good source of vitamin D. If you're vegan, you can do fortified orange juice, fortified cereals, fortified soy milk or soy, rice, or almond milk. Those are all going to be good. Mushrooms are also a good source of that. So just to recap, yes, vitamin D is beneficial for general health and immunity. And for healthy lungs as well. Do we know that it is specifically beneficial for COVID-19? No, we do not. So, and if you need a supplement, that is going to be something that your doctor will tell you based on your vitamin D level, that we can actually test for that. And again, if you've recently had a physical, you probably have been tested for that, and your doctor should be able to let you know either by calling, or you can check your records and see if it's there. So I hope that information is helpful. I have my website is drmoniquemay.com. If you go to my blogs, I post quite frequently about COVID. I just did a blog about foods you can eat to boost your immune system. So go there and check that out. I have a blog coming out tomorrow about foods that you can eat to help with depression and anxiety that some people are dealing with now. So be sure to check that out there. And then just one housekeeping thing for those of you, and we appreciate the interest. We have several hundred people wanting to be admitted to the group. If you are watching this, or you know someone who is, there are screening questions that Dr. Singletary put in place for a reason. And if you don't answer those questions, you will not be admitted to the group. We have to have certain safety checks and things to make sure that who's getting in the group is who belongs in the group. So if you can, please answer those questions so that we can facilitate you getting admitted to the group. So hope this information has been very helpful. Please be sure to post your questions. I will certainly respond to them. Again, my name is Dr. Monique May, board certified family physician, also known as Physician in the Kitchen, and through my best-selling Amazon book, blogs and posts, I help busy households enjoy healthy eating without impacting their hectic schedules. Take care, everybody, and be safe out there.